serious back pain. It affects 1 out of 3 Americans. It is the single biggest reason for emergency room visits and missed work. And though there have been great strides in treating back pain, one type remains elusive. Dr. Bruce Dall, an orthopedic spine surgeon at one of the Midwest's leading neuroscience centers, has pioneered a fusion surgery to treat patients with sacroiliac joint dysfunction. On a spring day in 2008, 4 women gathered together at Borges Medical Center in Kalamazoo, Michigan, to recount their experience with SI joint pain and the fusion surgery performed by physician Bruce Dall.
My name is Zeb Lemons.
Jennifer Hughes.
Michelle Leidenfield. I'm Catherine Cummins, and I live in Allegan, Michigan.
I am from Fenton, Michigan.
I live in Kalamazoo, Michigan.
I'm from Tolono, Illinois. I was kind of a workaholic, and all of a sudden, I could barely make it through a day.
My back felt like it shifted, and I actually lost feeling in both of my legs for about 12 hours. And I literally could not move my legs at all.
I would have to take vacation day to get a long weekend to get, to take like Vicodin, frankly, and muscle relaxers just to get like a day or 2 of sleep.
And your whole body hurts, you can't function, you can't think. You know, and it's not only does it affect you, but it affects your family around you.
I had this pain in my back somewhere that I couldn't locate that lasted for 7 years.
I think they tested me from everything from multiple sclerosis to rheumatoid arthritis.
I just gave up. I was like, you gotta be kidding, I gotta learn to live with this. And I just wanted to give up on life. Here I was, 38 years old, and it's like, I have no life.
Each one of these women had sacroiliac joint dysfunction. The sacroiliac joint is the joint that holds really your pelvic bones to the spine. The tailbone, which is the lowest bone in the spine, is attached to the pelvic bone, and the sacroiliac joint's the big joint that attaches, and you have one on each side.
When you have pain in the sacroiliac joint, you basically get pain right in your low back, right below your belt, just right over your upper buttock.
I searched around to find relief like everyone does, and I went to, chiropractors, physical therapists, I worked with pain management techniques and many different options. And the final one option is to get a shot to help relieve the pain. It's like a cortisone shot. And I went to a really good doctor that could do that. And as soon as they go into that spot, they've hit it. And like Dr. Dall said, it's the test that's golden for you. You know that you have it.
So we learned through thousands and thousands and thousands of these injections that the sacroiliac joint is a significant pain generator.
Now, there are many surgical varieties that have occurred over the years in an attempt to stabilize this joint, but they've really been performed in an effort to try to stabilize a joint that's been pulled apart or traumatized in something like a car accident. Several years ago, I published a paper on a new way to fuse this joint. And basically the way that that's done is by making a midline incision, and through that incision coming down to the fascial layer that attaches to these spinous processes. Then I can split that layer in 2 and tunnel right over to the pelvic bone. That's a very minimally invasive way to get there where no muscle's involved. Then I take a little bit of bone right off of the back of the pelvis, and that allows me to then see the sacroiliac joint itself. And so I curette out the sacroiliac joint, and then I put a cage right down in there between the sacrum and this pelvic bone. And then I put screws on both sides, one into the sacrum and one into the pelvis with a short little rod to pull it together. And that compresses the joint and stabilizes it so that that joint can go on and fuse.
I am in less pain than I've been in and since 1999, and I have more mobility.
For the surgery, it felt like it was well above a 10 on the pain scale. And then after the surgery, it was like, at max, it was like a 4.
I didn't know that there was a surgery that had been perfected for this. So I feel very lucky that that Dr. Dall did the surgery.
My bad days now are nothing compared to what they used to be. I mean, I can get by with that. I can laugh again. I play with my grandbabies. I take them overnights now.
This surgery was less stressful on my body. I felt better throughout it.
5 doctors in the United States can't take it all. They can't do all of this. It's got to be more doctors that are willing to learn how to do this and give this option to other people.
You know, I have hope for lots of things. And I know that humanity exists because of hope. And when it comes to treating chronic pain, we hope that we can find the source of the pain and eliminate it.